Welcome to HERcast with Dr. Chito, the podcast where we dive deep into the issues that matter most to women, their health, and their well-being. I'm your host, Dr. Chito, and today we're talking on a very important topic that affects us all, mental health. From anxiety and stress to the growing pressures of social media, mental health is something we need to talk about openly and honestly. Joining me today is a seasoned expert in the field, Dr. Chinyelu Ada Ikeako. She's an American board certified psychiatrist who completed her postgraduate residency in general psychiatry in 2010 from Columbia University at Harlem Hospital Center and went on to specialize in addiction psychiatry at Mount Sinai Hospital and the Bronx Veterans Affairs Hospital. Dr. Ikeako has spent years helping individuals navigate the complexities of mental health, and she's here to share her wealth of knowledge and how we can take better care of our very important minds. Whether it's learning to manage stress, dealing with anxiety, or breaking free from addictive behaviors, Dr. Ikeako will guide us through practical steps to improve our mental well-being. So don't go anywhere. Let's get into it. Welcome to Headspace. Let's talk mental health. Welcome, Dr. Ada Ikeako.
Thank you, Chito.
I call her Dr. Ada, so if I keep changing to Dr. Ada, please don't.
That's fine.
I feel like this is like the first episode on mental health, and it was something that I've always wanted to do because I believe very strongly that mental health is as important as physical health, to be honest. And there's so many links between mental health, physical health. And right now, with all that's going on in the world, all that's going on with our kids, youths, I feel that this would be a great time to really, really discuss what's happening with us in terms of our minds. The first thing I'm going to talk about is anxiety and depression. I mean, a lot of people will tell you, I have anxiety, but they don't understand what that really means, or I'm depressed. And they don't understand, depression is like, I'm just sad today, or depression. People use it casually. Mm-hmm. So what would you say and describe anxiety and depression? Because they kind of go together, I see. And then what causes anxiety and depression in most people?
Thank you, Chito, and you look lovely.
Thank you.
So, anxiety is actually a physiological response to a threat. Mm-hmm. So not all anxiety is bad.
Yes.
Okay. So if a bear came into this room,
we'd all jump.
We'd all jump.
Yes.
And we'd be ready to either fight or to flee.
Yes.
Okay. And so that is a normal response to a threat. But when it becomes excessive, when it becomes complicated, then that's when you have an anxiety disorder. And there are very many types of anxiety disorder. You have your generalized anxiety, which is every day, worrying about everyday kitchen table things. You have your social phobia, which is fear of, being in public, speaking in public, or presenting in public. You have your specific phobia. Some people are afraid of heights. Some people are afraid of, injections.
Or animals.
And so you have your specific phobia. You have your social anxiety. And then you also have separation anxiety, which is anxiety in childhood when a child is first asked to go to school and he just doesn't want to go because he's afraid of, what to expect in school. You have your panic disorder where the lack of cues, that's uncued anxiety. All of a sudden you start having panic attacks, right? That last for more than a month, where you can feel lightheaded, your chest pain, your shortness of breath, numbness, tingling, chills, cold sensations, heat sensations, paresthesias, and the like. So these are, some of the commonest types of anxiety. You also have depression. Depression is low mood for 2 or more weeks with anhedonia, which is a loss of interest. You have 5 or more of the following characteristics: poor appetite or excessive appetite, weight gain, weight loss, loss of concentration, loss of energy, and the like. Sometimes you have suicidal ideation if it's very severe.
Yeah.
And so these are sleep might also be compromised. You could have poor sleep, or you can sleep excessively if it's an atypical type of anxiety. So these are basically the definitions of anxiety and depression. In a place like the UK, the number one cause for outpatient visits is a mixture of anxiety and depression. And I think it's the same here.
Yes, it is.
Because in the US it's different. You have social phobia as the number one cause of anxiety in the United States. But what I see is more consistent with what the UK reports in their statistics, that it's a mixture. Every day you go to the clinic, you have a new case of anxiety and depression combined. And so we see a lot of mixtures. They're comorbid with each other.
Yeah, and there's sometimes they say, like when you said excessive appetite, some people don't believe, and I don't know if it's a real thing, but when we say stress eating, some people times I feel that when you're low mood, I don't know, like for me, that's when I crave ice cream, I will not lie.
Yeah.
No matter what diet I'm on. But if you're in a low mood, you have this craving feeling, like you feel, it's almost like you eat to feel somewhere.
Yes.
That like a void, but a void that you're not, do you, in real sense, is there anything really like stress eating?
That's absolutely correct.
Okay.
I mean, what are you trying to do when you eat or when you have sex or when you run a marathon? Is to release dopamine. Dopamine is the feel-good hormone. Okay. Right? You want to feel good. It causes vasodilation, increased perfusion to tissues. So, anxiety and depression make you feel low. But what you want to do by eating ice cream is to reignite the memory of a dopamine high.
Oh.
Right? And so you're trying to counter the lowness, the depletion of neurotransmitters that you find in anxiety and depression. By substituting it with an activity where you feel euphoria and dopamine release and norepinephrine and some other chemicals are released, and enkephalins are also released as well.
So I guess that's why exercise also helps a lot.
That's right.
You go and you hit the treadmill and you feel like, okay,
yes,
I have kind of released something.
Yes. In fact, people sometimes ask me, what can you do? Going for mental health treatment is so expensive. Diet and exercise are two things that you can do. You can actually significantly impact on your mood if you eat the right healthy vegetables, have your little garden.
These vegetables chase us all over.
You can't get away from the vegetables.
I gotta get away from the vegetables. Oh, wow. There's another thing I think before I go to the next question, is another thing that I feel seems to be a common thread when people are talking about, and it always makes me cue me in that this person may be suffering from depression. This feeling like there are people around me. I know I'm loved. I know there are people that care about me, but I feel so alone and disconnected.
Yes.
I feel like I really don't have anyone. Like there's like people are moving around you, and if you look when we do research, you see a lot of images of saying people are around me, but I'm so alone. What is that? What is that about, really? I mean, when you see patients that say that to you, how do you address that feeling?
When you're depressed, you don't even want to get out of bed. Right? That's anhedonia. You don't have pleasure in anything. All those things that used to give you pleasure, going out with people, spending time with friends, that is all lost, in depression. And so there's social isolation, which is a symptom of depression. There's also a protective measure, when you talk about somebody that spends most of the time by themselves, withdrawing. There are different things that can cause that. A schizoid personality, for instance.
Yes.
So you just prefer to be alone on the computer. You just don't, and you're fine. There are people that are alone, but they're not happy with it. They want to be with other people, but they just can't seem to find their way through. And so that's social isolation when you've had trauma. It's called avoidance behavior. So, and you're hypervigilant. So you don't want anything that's going to rock the boat and perhaps predispose you to the kind of traumatic experience that you've had before. So it's a bag that contains a lot of different, diagnoses under it. So the thing is to explore and investigate what is really going on.
Okay. Now we're in I don't know if you have seen a higher number of cases in these past few, should I say months or year or whatever, where things have become really tough. And there are a lot of, with unemployment, economic instability. Another thing that's common, I think, well, I don't say it's common in Nigeria because I stay here, but also issues, relationships. Women carry a lot of burden sometimes, with their kids, their family, their parents, their extended family, and also deal with issues maritally and all that. What are the little tools that you can give? I know the most important thing that if you're feeling, like we always say, if you feel like the need, you have any depression, like you said, anxiety, to see an expert like you as soon as possible. But what other tools can women use to help them through this multitude of stressors in their lives? So, I mean, some people are not up to depression, but maybe chronic stress, because this is chronic stress that you
Yes.
meet every single day. And sometimes I'm hearing words like burnout. I'm hearing words like meltdown. I'm hearing words like I want to give up, not give up on their life, but just not do anything anymore. Or, I'm hearing people question even their parenting. You're hearing a lot of negative self-talk. So what are things that you will advise us to start doing in terms of being able to navigate this stressful time?
Yeah, I mean, there's so much that can be done. I mean, first of all, is what you mentioned earlier on, is to have parity between physical and mental health. I mean, that's been going on for at least the last decade or more in the US, for instance, because it wasn't always the case.
Yes.
And so when there's parity, then there's more room for organizations to spring forth and participate in this discussion, all hands on deck, all heads to the table. Like what you're doing today, you're inviting mental health to speak on mental health issues. We have to have talks, we have to have workshops, we have to have seminars. We have to, reduce the stigma, the shame of talking about mental health issues, because, still we are under this shroud of stigma.
Stigmatization, I know.
Stigmatization, and that's stopping people from coming forth. Only 10%, 1 out of every 10 is ever treated for mental health, that has a mental health diagnosis. Even in the US, it takes 7 to 10 years from the time the patient initially presented, with mental health symptoms to the time when they actually engage in treatment. So, and a lot of that has to do with the shroud of stigma.
Yes.
What I would say is good self-care. You have to take care of yourself. And there are different aspects of self-care. There's physical, there's social, psychological, financial, professional.
Professional, yes.
Yes. You have to educate yourself, inform yourself, read, and know how you can improve on your levels of self-care. The sense of community, I think one thing that helps us a little bit is that we're able to talk to each other. Community, church for us is a big one, and the mosque.
And that was even my next question, how that really helps.
Yes. So we are spiritual based individuals, and a lot of our succor comes from our religious organizations, and so they have a huge role to play in helping us combat these stressful times.
I think I once saw a study on where they said something about Africans tend to do better in terms of treatment with depression because of that support, the extended family support, and religion. I don't know if that's something you see a lot here compared to what you see in the US, because you have worked in different continents, so you can compare based on just your normal practice. Do you feel we do better, like in terms of?
I want to tell you I want to tell you somebody that told me something that just blew my mind.
Okay.
He said, and he's somebody that I respect a lot, a mentor as it were, and he said, look, the way we treat each other shows that we really don't have the God that we talk about. That if we truly have the God that we talk about, that the West, even though they don't go to church physically as much as they used to some generations ago, but the systems they put in place, the way they safeguard those systems shows that they really do care about each other. And that is a manifestation of the God in them. When he said that, I was like, what? Because before that, I was like, no, in Nigeria, we're the God people.
Oh, yeah.
We are the God
Everything
people.
Everything God's grace. We end with his name. Yes. We start with his name.
That's right. And so, I guess there are different ways of looking at it. But to answer your question, religion, is free. That's one thing. You can pay your tithe if you want to, but nobody's going to mandate it. So for masses who cannot afford, who are underemployed or unemployed or earning below the minimum wage, for majority, over 97% of us are under minimum wage. I think we cannot do this without the consent and, input of the church. But that what they're talking about in spheres is regulation, more regulation of the role of the church in mental health treatment so that it's standardized. It isn't just, oh, I cast
And
that.
I guess other religious organizations as well.
And other religious organizations, definitely the mosque as well, but they have helped a lot of people cope during these difficult times.
And I love what that guy said makes sense. Community support is really the reflection of your spirituality.
That's what he was saying.
You cannot just walk by, do whatever you want to do, hurt somebody else, or take advantage of somebody else and believe that, because that's, to me, is part of the stress here too. And we talked about stigmatization. How do cultural stigma around mental health prevent people? Should have to understand this specifically. How does cultural stigma prevent people getting proper treatment like therapy or medication? And I use the word cultural. I should even say cultural and religious, actually, because that's when our climb, one of the times where we keep advocating for mental health awareness and to tell people that, here, when you say mental health, they think crazy. And it's not crazy. Sometimes it's just some, like you say, like you said, some neurotransmitter. You talked about dopamine. It's some depression of some kind of neurotransmitter. It could be medical. And it could also be, psychology will tell you, it could also be some from not having the right coping mechanism or thought process.
That's right.
So how in your practice do you see that this really hinders your work? Like this becomes a block to what you want to do for a patient?
Yes. I mean, something that stops over 60% of patients from accessing treatment is a problem.
Yes.
I mean, for religion, when it comes to religious stigma, I mean, the thinking is that when you have a mental illness, it means you're demon possessed. And so either you need to flog that demon out of you or you chase the demon out and everything. So everybody looks at you as different from the other. I mean, we're social animals. We want to fit in.
Yes.
But then this stigma makes you different from the other. So you're out there. You're the odd person. And so what's that? That's going to fill you with shame. So there's shame. And then you self-stigmatize. When you self-stigmatize, you turn that stigma inwards. And that's the depression. And that's the suicidality that we're talking about. And so stigma is a problem. Sometimes people believe that it's because of something you did, bad choices you made. That's why you're depressed. And so again, there's that shaming and there's that blaming, and so people don't want to talk about it. That's the bottom line. They just want to just keep quiet about this, and they suffer in silence.
And it's real suffering because I feel emotional pain is painful. Like
it is.
Emotional pain is horrible.
It is. Yes. You're right. Emotional pain is horrible. And it is painful. I mean, you talked about the role of the central nervous system. That's the seat of control of every organ in the body. And that's the part of you that is diseased and dysfunctional. So your physical health will also ultimately be affected. And so, it's horrible to have to deal with a mental illness and then not to be able to talk about it, not to be able to seek treatment.
Yes.
There's too few centers. I mean, we have like maybe 300,000, psychiatrists or thereabouts for a population of 200 million.
I didn't even know you guys were up to 300,000. I'm up to 300,000.
Well, or something of that nature,
I know it's less. Okay,
but
because Abuja, I don't know.
Yeah,
because I know that I keep on thinking we need more, psychiatrists and psychologists for what's going on right now.
Yeah, maybe that's all mental health providers, not just psychiatrists.
Okay, plus
psychologists and social workers, counselors, and everything. And so, they're not enough. How can that be enough for a population of over 200 million? That doesn't make any sense.
It's not at all.
So, and then when you do access the treatment, it's expensive, right?
Yes. It is. That's the cost. Yes. Even the medications are really expensive.
The medications are getting more expensive. The medications, every week you go for medication, the price has gone up.
Yes.
Right.
That's, I think one of the things because I've seen women a lot, you see a lot of people going through stress. And I think one of the things that I find is working now, and I want to start, is more of a support group kind of setting, or allowing them to speak out or speak to someone that's going through something similar, like, that's going through. Because when it comes to struggle, everybody has their own unique, different struggle. I also feel like, I don't know if you know, but journal writing, because sometimes it's not being able to let it out. So I always look for ways to journal and all that. But I know that when we talk about, I always tell people that one of the things I always felt in psychology was interesting is that you think before you feel. And I think you do a lot of I think you also do cognitive. Yeah, so
Yes.
I won't talk more about that because I feel like people don't understand how powerful the mind is. So aside from maybe the depression that you treat, people going through really hard times, either be grief or financial downfalls or things like that, that are really causing a lot of stress. How do you approach them cognitively in terms of trying to change the way they're looking at what they're facing so they can feel differently or be able to cope through it? How do you do that?
Well, the thing to do is to understand that there's a correlation between the way you think, the way you feel, and the way you behave. These three things exist in tandem. They exist in equilibrium to one another. So when you change one, you change the other. So you are what you think. You become what you think. So you need to, like you talked about, jot down your thoughts, guard your thoughts religiously.
Yes.
You must, the way you guard your prayer and your belief in God is the way you should guard your thoughts, because that is the essence of your life. If you think negative thoughts to a situation, the same situation can happen to two different people, the very same situation, but somebody will look at the positive side, whereas the other person will be downcast and upset and thinking all kinds of negative thoughts, like catastrophizing. This is the end of me, the worst possible, all or nothing thinking. It's either good or bad. There's no gray in between. There's no learning point, and so many different types of, cognitive distortions, personalization, blaming yourself for everything, labeling, and different types of cognitive distortions. So first thing is to identify the distortion. You have to write it down. You have to say, why am I feeling so down? What am I thinking? Okay. And then ask yourself, what I'm telling myself, is it true? Because most of these thoughts are irrational.
Yes.
They're irrational thoughts and they're excessive. There's no middle ground. People think in terms of extremes, which is not realistic and it's not truthful. And then you have to ask yourself, after, is it true? Is it useful for me to go around thinking those negative thoughts? No, because it makes me more hopeless. It makes me more anxious. It increases my guilt. It increases my depression. So what's a new thought? What's a new way? Things may be hard, but the future will be brighter, Things must be hard, but I've had good times in the past and I can do it again. Yes. You have to build that muscle of self-efficacy, belief in yourself, that you have what it takes. That's the number one factor, even in addiction and mental health. Do you believe in yourself that you have what it takes to overcome an obstacle? And then, of course, like you mentioned, this sense of community coming together to tackle problems, like we're doing today in this in this studio.
Yes. Very important.
So that's cognitive behavioral therapy, and those are the key principles.
Oh, wow. That's amazing.
I like what you said about support groups. I think it's really important. That's the role of the community. The role of experts like yourself, the role of the church is to bring together these groups of people, all hands on deck, all minds brought to the table to, create this structure that will facilitate the healing of Nigerians and others.
And I like that word healing because I think a lot of people are wounded. And I think it's sometimes this sadness and this giving up feeling comes from that healing. Like I'm as a doctor, Dr. Chika, that that talks about that trauma and healing from trauma. And I feel a lot of people are traumatized. A lot of trauma going on here, and I'm seeing it even in younger people who have gone through things that we talk more about in the Western world than we talk about here, like abuse and things like that. So I think also in that angle, I know there's so much talk about under mental. I'm like, how do we talk about everything? Now, there's something I call the double-edged sword. It serves great purpose, is a great addition to many of us that want to reach people out there, and it's also serves as educational also platforms, business platforms, but it's also a double-edged sword, causing anxiety especially in our younger population, causing wrong perceptions, and that's social media, the anxiety of social media. And what is happening, what social media is doing to some of our kids or some of even the adults. We're addicted to social media. But before I even move to addiction, I want to ask you, what is your take on social media and mental health right now in terms of your experience?
Yeah, I think social media can make or break you depending on how you use it. Okay. And unfortunately, a lot of people go on social media and they're not well informed as to how traumatic it could potentially be. A lot of people are isolated and they're looking for support and comfort using social media. And sometimes they let out too much information about themselves out there, and then they become more vulnerable to predatory practices or people taking advantage of them. Sometimes there's a false image because everybody's trying to post like they're doing well. And, sometimes you have, even when it comes to body shaming, like that perfect figure, perfect complexion.
Yes.
And so people start to feel deficits, that they're dysfunctional, right? And so this is all coming from social media. There's a lot of bullying going on social media, where groups of people now attack one individual, and that's led to suicide.
Given almost like a safe space to attack. Like
it's a safe space to
do
attack.
Whatever they want. Yeah,
there's a safe space to attack. You can even post things and attack people, and do it even in a discreet way, but it's still an attack.
Yes.
And so a lot of people are being attacked. A lot of suicides are happening as a result of social media. In fact, in some Western countries, they're trying to limit the age of social media, and they're also trying to limit the number of hours that children can spend online. And so there's a lot.
I am struggling with my kids. Ooh.
How old are they?
My 14-year-old, and I have an 8-year-old. So 8-year-old, at first you go like, oh, just do YouTube Kids, and you find out that YouTube Kids is not just as benign. Although I tried to do the whole 1 hour a day, now I'm back to like nothing during the day, watch normal TV, for 1 hour, and then we can do social media on the weekend for a limited number of hours. But it's always a struggle because it's hard to find people that. But I don't want to interrupt you, but that's always a struggle. The way you said, I'm like, that's one of the biggest parent struggles we have.
I mean, I know that there's some gadgets that can sort of block certain sites.
Yes.
From children's, the social media.
True.
So, so that's also something that might be helpful. But you have to make, what I talk to people in addiction, like social media addiction.
Yes.
You have to know your kids. They have to be your friend. When somebody is, for instance, offering them drugs or, making it seem as if a party where they're getting high on different substances is the norm, your child should be able to come to you like, Mom, Dad, this is what I'm seeing, and I don't know what to do. I feel like I may want to join this group. So there's a lot of parental support that we do, in the organization that I work for, to help parents navigate teenagehood, to help them. Most people are offered drugs from the age of 10. So that's preteen.
Yes.
It's a 10 to 17-year-old. So we're even losing the battle because we're trying to get to a 14-year-old or a 16-year-old. But this started when they were 10 in the end of primary school, based on the statistic.
Wow.
And so, if your children are not comfortable enough coming to you to open up, they will listen to other voices who are predatory, who do not have their interest. Who do not have your family interest. And let
your children hear you first.
Yes, let them hear you first. Let them hear you often. Hear them. Let them feel heard.
Yes.
Always, no matter how bad the situation is, let them be able to come to you and talk to you about it. I think that would go a long way.
Because, in Nigeria, the whole idea of child raising is like, you're not firm enough. You have to be there. And I keep saying to people that how our parents were maybe, very strict, and I didn't even have, my father was not even very strict, but how parents were generally, people think is we can apply the same principles now. We can't.
No, you can't.
What we're facing now, we need to be strategic and wise about it. And I think one of the things, my son used to bug him sometimes. You say, nobody's even listening to what I'm saying. You did something wrong. And I get to the point where I'm just like, you did it. And you're not even listening. You haven't even heard one sentence. So, you're right. That being heard gives them that confidence. But there's a balance, I guess, finding that right balance.
That's right.
Where you could be friend and mother.
Yes.
You're a mother and you can also be a friend.
That's right.
Because if not, they're going to have friends that you don't want them to
That's
have.
right.
And now they can have it without you even knowing the person's name.
That's right.
Because it could be off some screen.
That's right.
And it might not be, even if you seize all your kids' devices,
yes.
Another friend could have a device somewhere else. So you have to, I think it's one of those things that we have to start talking about it.
Honestly, what is happening is
our parents can advise us in this one. We have to come together and sit down and say, hey, how are we going to deal with this?
That's right. What's happening is that children are becoming addicted and the parents are not aware. until they're deep into the addiction. I've been on it since, and they'll be like, I've been addicted since I was 13. And the patient is now 20, and that's the first time. It's now gotten to an extent where they're now having consequences. Either they're psychotic or they're not able to graduate from school. Everybody's wondering why. They're not able to keep a job. Everybody's wondering why. And then at that point, they bring them in for treatment. But this is 7 years gone.
That's so we're talking about addiction to drugs too.
Yes, addiction to drugs, as well as social media, but also drug addiction.
Have you seen a lot of kids being brought in or young people brought in for addiction to device, whether it's games, social media? Because I know in America there's a big talk about how kids are addicted now to, and they have the symptoms of withdrawal. Like you take it, they get angry, they get.
There's this debate, which I think is moving towards labeling more of these, like social media addiction, bringing it into the DSM-5.
Okay.
Yeah, we're DSM-5. And the problem was that people were not sure whether there was a withdrawal syndrome, whether there was a tolerance syndrome.
I think there is.
But the people that are on the side of bringing this into the limelight, into evidence-based, right, into diagnosis, is that there is a withdrawal syndrome, there is a tolerance syndrome, there is a destruction of life, just like you'd see with cocaine or marijuana, or codeine. And so, hopefully, we're now DSM-5 TR, so the next one is DSM-6. Hopefully we'll have more. Now, the only thing they put in that wasn't there before was gambling addiction.
Yes.
So that's in now.
Yeah, okay.
It's in the DSM-5 TR, and so hopefully social media addiction and other forms of shopping addiction and other forms of addiction should also come in, I think.
Because they all have that withdrawal. You can't keep them, you can't crave, you can't stop yourself. It's an addiction. Yeah. Yes. Now, let's go deeper into drug addiction, because like you gave a statistic now that kind of like, wow, 1 out of 2 houses in the north of Nigeria have an addiction.
It's a terrible thing.
And so I just want us to really go in, because this is very important. I feel that one thing about addiction to drugs, it steals your life. And it's one thing that I know will break any parent's heart to see your child addicted to a drug, but it's not a life ender at all. It's a process that requires, I believe, not just the person coming and agreeing to be treated, but the support around without judgment.
Yes.
It's so important. So can you tell us more about what you're seeing in this fight against drug addiction with what we're seeing among the youths when it comes to with drugs on the street?
What we're seeing by far is what they call polyaddiction. So the average patient that we see is addicted to 3 or more substances at the same time. Another thing we're seeing is more addiction in women. So women of childbearing age are now getting more addicted, and that puts not just themselves, but the babies, the pregnancies at risk, of withdrawal, and abstinence syndromes. And so, that's another thing that we're seeing. We're seeing a younger age, people coming in younger and younger, which means that we're losing the fight in terms of, catching this thing early enough. By the time they come in, they've had over 5 years of addiction in most cases.
Wow.
And so, these are some of the characteristics. One of the commonest drugs, some of them are marijuana. That's about the common. And nicotine, of course, cigarettes that's the most addictive.
People don't look at nicotine as being addictive.
But it's the most addictive substance. It's more addictive than cocaine.
Wow.
Nicotine is more addictive than heroin. And so, and the gist when it comes to addiction treatment, if you can control the nicotine, which is the most addictive, the probability is a lot higher that you'll be able to control the other drugs. Because if you can hit the one that is the most addictive, then those subsequently can fall into place. So it's wrong. It's miseducation to not consider nicotine when the control of nicotine could be a predictive, factor for the control of the lesser addictive substances.
Wow. And are you getting good response? How do parents or family or guardians behave when their kids are addicted in terms of treatment? Are they very willing to cope, or are they in denial? Because I feel a lot of time parents are in denial. Those years that you talk about them not noticing, I feel that the way drugs work, I feel like you will notice something is off. You will notice they're either withdrawn, you will notice certain things, at least if you're a child, you notice, I'm not judging, I'm just thinking that you will notice something is happening. But there's an inner denial. I mean, who wants to accept that, oh, my child is going through an addiction? Because why? I always tell people, it's subconsciously you feel like you failed.
Mm-hmm.
You blame yourself, self-blame. And so do you find that you have a lot of parents that fight that denial process while you're treating their kids?
Yeah, I mean, sometimes you find a lot of denial, right? And then sometimes a lot of enabling behavior, where this is my son or daughter and they're addicted and it's not their fault, it's someone else's fault. And you that are treating them, you have to treat them in a certain way, you know. And so even sort of making it a you versus them scenario, the treatment team is now the enemy. You know, and that's their way of dealing with the fact that I don't really want to be here dealing with this, and why should my child have this? You know, so that lack of acceptance transfers the hostility to the
treatment team.
And so we have to deal with not only trying to treat the patient and get the person cured from the addiction, we have to deal with the hostility, not all the time, you know, but sometimes, because of the enabling behavior of the parent, you know. But what we try to do to counter this is to give them what is evidence-based, what is statistically sound medicine that can be researched and validated, right? And so, you know, we can calm their fears, allay their anxieties. But that sense of disappointment, grief, you know, some of that denial is just grief. You know, I'm dealing with so much and now this, you know, the cost of treatment is also a big,
it's expensive.
It's very expensive.
Woo,
so people are like, things are so hard. And they're also angry. They're angry at their child. So it's so many different emotions, you know, because addiction affects the whole family.
That's what I'm about to say. It can take the whole family.
Yes.
It literally affects the whole family. That's for sure. It's not just the child. It's everybody affected, the siblings.
Yes.
Definitely.
Some are depressed, you know, because when people are irritable, for many people, it's because they're sad. You know, and so that sadness, it manifests itself as sometimes they feel guilty. Somebody told me once, I think it's because I was a perfectionist that my daughter ended up using drugs. So there's that. What did I do wrong? You know, when you didn't do anything wrong, it's peer pressure. But
because it's one taste. It's from one taste. It's a you know, it's that period of peer pressure, and you know, all of us pass through teen, and we know that sometimes you have those people that have very strong children that have strong personalities that can convince another child, just try this. You know, and that's why you talk about getting to your children first, because if they were equipped with the knowledge of this thing could take me, and if I take it, it can do this and do this and do this, it gives them some resistance to say, no, I'm not going through it. You know, I mean, one of the things growing up, I don't even know, I can't remember if my parents ever told me that, but I remember just knowing in my mind, like, that thing they call marijuana, I feel if I ever take it, I'll go mad. You know, and I don't think anybody ever told me that, but I had that in my, so it was a no-go area. Like I didn't even need to, I could never be tempted about it. I just felt like I'm very hyper, I'm a very active person, I don't want anything to stop me from thinking. And that was, I know, I don't know if my parents ever sat down and said, this will stop you from thinking. I don't even remember that. All I remember that whatever was told or however it was, that was my resistance. And that's the resistance so talking, I think being able to openly talk to your children about drugs and about, because I have parents that will say to me, no, I don't want to bring that up. Let them, because they don't know, I'll now be the one to tell them. I'm like, you want to be the one to tell them. And it doesn't make them go look for it. You're trying to prevent them from accepting it, you know, with knowledge. But I think, so what I want to say now as a community of us, like women, how we are, what can we do? What ideas do you have that we can do? Yes, you guys are doing your work in managing patients, but what work can we do to get people to you to manage, you know, in this case, and also to create a real drug awareness? I mean, there's so many, and I know there are nonprofits out there and some people really advocating against drugs, but I don't think the sound is amplified. How can we amplify the sound to save the young people from drugs?
I have certain ideas. One thing is to include it in the school curriculum from primary school. So you have classes on drugs, you know, different classes of drugs, different side effects, withdrawal tolerance, everything, you know, because it's a chemical hijack. So the children think it's just recreational. I'm just going to taste it once or twice and hang out with my friends. And the next thing is a lifetime of addiction that you can't get over. It only takes a weekend of cocaine 6 tries of codeine and you're addicted.
You're addicted,
like
yes.
you said, the same day.
Yes, yes.
You know, so there has to be education. We have to think about prevention because most people are not going to be cured. That's the honest truth. You know, and so, you know, it's better for us to prevent that. And then another idea that I have is if we can screen, apart from parity between mental and physical health, if we can screen early.
Yes.
If we get into the habit, you know, when
every well visit,
you know, I always ask my patients, you know, do you have a primary care doctor? Do you go for your annual physical? In that, very important, but nobody, you ask them, nobody has that. Very few have that.
Because most people here and parents here think after vaccinations, I'm done.
That's right.
But it's wrong. Your child needs to see a primary care, a doctor every
That's right.
year.
That's
how you catch those
That's
things.
how you catch it. So, you know, primary prevention, you know, secondary prevention, not just tertiary when the thing has ravaged and you're just trying to prevent complications, you know, and so we need more education, more screening so that we catch this thing early before it becomes this you know, big issue.
So I think that's one of the things we're going to really, really try to work on because that's one of, it touches my heart. Now, when we talked about social media, but there's something else going on here. Young people, body image. There's a name for it, right? Where people have this distortion of
body dysmorphic
disorder. Are you seeing more of that? Because I'm seeing a lot of people looking perfect to my eye, and maybe for my child will say, "Mommy, you know you're old." I said, "Okay, so I'm old, meaning I can't see properly." But I'm seeing people looking perfect, but keep on like going into all sort of things on their body. They don't see. You see very people that are looking healthy, and so I don't know. And based on maybe social media or what's out there, are you seeing a lot of it in your practice?
Yeah, we see
and how
some.
do we deal with this?
We see some. If you ask what the NICE guideline says, it says fluoxetine. If you meet the criteria for body dysmorphic disorder, which is perceived minor defects, you know, are being magnified in terms of your appearance, then you have to go on a course of SSRIs, selective serotonin reuptake inhibitors, of which the one that has been most studied and been most effective is fluoxetine.
Okay.
There's also comorbidity between body dysmorphic disorder and depression. Body dysmorphic disorder and obsessive compulsive disorder and other anxiety disorders and addiction, substance use disorders as well. So the thing is to know whether you meet a criteria, a diagnostic criteria. That's the first thing. If you meet a diagnostic criteria, then you can apply evidence-based treatment to that diagnostic criteria based on the research. Generally, Nigerians like to dress well, I must say.
Yes, we love
it doesn't matter how much money in my pocket.
It
doesn't matter how much I will represent. We represent. And their taste is very high.
Yes, so
they know what the good life looks like.
Let me sound like Gen X. Our steeds know they take class.
So I'm actually kind of proud about that, you know. But, you know, social media gives you this perfection. If you're not that slim, if you're not a certain complexion, then you can't belong. If you don't dress a certain way, then you can't belong. And so sense of self is something that parents have to develop in their children.
And very important.
It's very important.
Very important.
You know, you have to believe in yourself. So you have to believe in the family that you come from. You have to believe in the values of your family. You know, have to be communicated to you in a way that you internalize it. So when you see that other coming at you and saying, if you're not a particular weight, height, or do drugs with us, or if you're not cool, something in you that's already been put in you at an early age is going to be saying, no, I think I'm cool enough. I'll pass.
Yes.
Right. If there's nothing there, then you might succumb when people keep pushing this thing, because they keep pushing these things on the young people. And so before you know it, unfortunately, a lot of them will succumb and then have problems.
I think that's important. Like I always talk about the true definition of beauty to my daughter, which it comes from the inside. It emanates from the inside. It's about what you do and how you impact lives. I always expose them to our outreach work and just things that I always feel that service builds character and gives you a confidence. There's a confidence it gives you that people can't seem to push. When you're helping others, you also help yourself
Yes.
by standing strong, as a person, individual, because you feel like you need to be strong to help somebody else.
Yes.
And I think it's something that I try. Honestly, with parenting, it's all prayers.
I think you're
and
succeeding.
and you're just prayers, and then you do you do the best.
I know you're succeeding. I know you'll pass on
the
best.
I really hope. I really hope. Now, just as we're wrapping up a bit, but what I wanted to find out is, how can we encourage people to seek help for mental health issues when physical health is often prioritized? I know you mentioned, but I wanted to emphasize how can we, because now a lot of things I try to do here is the hows, and how can we do this? We do the whys, then I go like, now how can we implement? How can we get people to, prioritize mental health?
You're thinking like a psychologist. You're looking at solutions. You're solution focused.
Yes, I'm solution focused. Because I feel that this is an area that needs to be addressed. I did my first degree in psychology.
That's why you
before I went to medical school.
Oh wow, that's why you sound so like
maybe
psychologically minded.
But I just feel like we need to, because I get tired of people feeling ashamed of something that they shouldn't be ashamed of. And if you look around, so many people are going through issues. I always say chronic stress can lead to depression, right?
Yes.
But one of the things we try to do is catch the stress part before you get in there. I remember when I did one talk, one of these, I can't remember what it was, and I did one talk, and we're talking about feelings and stress. And I remember, and I tried something out. Actually, I didn't even know it to work. I just said, okay, let's think of somewhere that's something that makes you extremely sad. Let's think of an incident that made you sad, that hurt you. And what you saw in the room when people were thinking, that everybody started frowning and squinting, and there was this look on their face. And I go like, okay, let's switch it. Can we think about something that, was the most beautiful time of your life, the birth of your baby, a new job, a vacation that you remember, and then everybody started smiling. And I'm doing it, right? And I'm thinking, wow, this thing about the mind and the feelings is so real. You understand? And that's what I used to tell people, that, look, it's about the mind, and the mind affects everything about you. And even if I'm taking care of your gynecology issues, you're having pain in your pelvis, and they come with the pain in the pelvis, they have panic attacks, and they wake up with the pain. I'm getting a lot of panic attack issues with pain and all that. And I'm having this, and I feel hot in here. And as I'm listening, you find out that, okay, you know what? There's so much more under this physical problem.
Yes.
That's the mind.
Yeah.
And it's not like we're pushing and saying, no, your problem is the mind. No. I never do that. I always try to make sure that there's no physical problem.
Yeah.
But I also know that the mental health is part of the mix.
Yeah.
But it's very, very hard. I can tell you, the first thing I always say is that maybe I need to refer you talk to somebody for counseling. And like, I'll tell you when I'm ready. So there's that, like, let's fix whatever I need to fix. I'll tell you when I'm ready. And I keep wondering what words or what tools or how can I convince someone to prioritize their mental health, even if they feel they have physical problems.
What the US did was that they trained non-psychiatrists, doctors, in psychiatric diagnoses, right? And gave them the capacity to be board certified in addiction medicine, for instance. So even as a surgeon, you could get that certification. And as an anesthesiologist, you can get that certification, because there simply weren't enough psychiatrists to do the work. And so, that's another approach. I know some countries in West Africa, they try to equip at the local government level these lay nurses.
Okay.
And community health workers.
Yes.
And try to equip them with psychological tools and train them, because they were the ones that were in contact with the population at the grassroots level, where a lot of these issues will first manifest themselves. So how do we solve this problem? It involves, public-private partnerships. It involves the civil society input. We have to keep talking about this thing. There's something called catharsis and abreaction. The more you talk about something, the less of an impact that thing has on you and on us as a society. So we have to have people who are talking and who are interested. in looking at all the barriers, the
Yes.
risk factors and the barriers, then have a strategic plan, like you talked about, strategic,
Mm-hmm.
that will address the barriers,
True.
that will address the difficulties of getting these things in place.
Yeah.
But just like inflation and every other thing, we need the government
To
support.
Definitely. I think that's where it's a little bit lacking. I mean, you hear a lot about other health, focus on other health issues than mental health.
Yes.
So
and that's because of secrecy and shame and and stigma.
Yeah.
Where people just don't want to identify as having any kind of mental problem. They rather live in denial.
Which is dangerous.
Even
for their health. I tell people that right now, severe stress has been linked with so many illnesses. For my practice, definitely linked with menstrual problems, definitely linked with fertility issues, definitely linked with pain. So we know that the mind and treating the mind is part of the treatment for your problem as well. They go hand in hand. So if this issue is important, this issue is important.
That's right.
Or else you're not going to be fully well.
Yeah, before they wanted to take one after another, but not anymore. Now you have to address them in sync as they occur in sync.
But I think you also need to enlighten our doctors here too, our health doctors, nurses, our healthcare workers about doing those questionnaires during the times you see patients.
Yes.
But in Nigeria, patients are not so into going to the doctor every year. That one, they only go when they're sick. For men, they go when they're dying. But it's important that we are now equipped with knowing, okay, this is the kind of questionnaire that you feel if you see a patient and you're concerned, or if the patient says I'm stressed, give them the questionnaire anyways. And I think from there we'll be able to pick up more, because the more people start talking about it, in America everyone has a therapist.
Yeah.
And it's not a shameful thing.
It's not. In fact, it's like going to church.
It's like a big deal.
It's like a high class.
Yes, high class. It's an elite thing.
It's an elite thing.
It's like, oh,
I saw my therapist.
I'm like, oh, I don't know what's happening in work today. I have to book an appointment
with
my therapist.
Why can't we
Everybody has a therapist. The more we talk about it, the more important we know that is what helps your mental health. That's how you can cope through madness that's going on around you. Is keying in and speaking up, and it is not shameful. No. Stigma is a lie about it.
That's right.
It's, as you have high blood pressure, it's the same way you're gonna have depression. It's the same thing. Medication or therapy or counseling will take care of it. And so I think people, too many panic disorders, too many anxieties. We need to open up and have a therapist.
Yes, I think you're right.
All right, before I finish, we didn't talk about something very important. When I talk about questionnaire, when I said questionnaire, I remembered something very important: postpartum depression.
Yes.
And even psychosis.
I was expecting that, seeing that you're
How could I leave that important part out? When patients come in and they have their babies and they come in and they're talking about being sad, being down, not connecting and bonding with the baby. I've had even a patient that's had hallucinations and delusions. That was many years ago. I've not had that for a while, but most times you get them, they're disconnected. They feel the questionnaire, the Edinburgh questionnaire. I use that religiously.
That's good.
Oh, I use
You're ahead of the curve.
I use it religiously for every postpartum visit, and then we try our best to refer if they need to, but again, it's a fight. Sometimes the mother will be there, so I'm here now, so she'll be fine. But it's real and it happens, and I want you to say something about it so people understand that it can happen after you give birth, and you must be open about it. There's nothing wrong with it.
So under NICE, it's 30 to 75% of women will have postpartum blues.
Yes.
In America, it's even up to 85%.
Yes.
It is the number one complication of pregnancy.
Yes.
Mood disorders.
Yes.
Okay. And so, within the first 2 weeks is the postpartum blues, which will resolve. And then if it doesn't, it persists and mimics a major depressive episode, then you have postpartum depression. 10 to 15% of women will have that. So we have to screen for it like you're doing.
Yes.
I hope other gynecologists and obstetricians like yourself
will say, I'll share the word.
Are also screening for it. Treatment is available. In the extreme cases where it turns into psychosis, there's a real danger of self-harm and infant harm, infanticide, right? And so, it has to be treated with medication and therapy. We have to look at the risk factors. Of course, you can also have it in men. About 10% of men will also have postpartum
Yes.
depression.
I know men are going like, how? Yes. When you're thinking of how much money you need to bring out.
That's right.
Yes.
That's right. And when you're thinking about how sad your wife is, you'll be sad.
You'll be sad yourself that you're not enjoying it.
You're not enjoying yourself because your wife is sad. So that's a sympathy reaction, right?
Yeah.
So yeah, you have to screen for it, know if it meets the diagnostic criteria, apply the evidence-based treatment to it, and it will respond.
And I must say for those listening that if you have depression or anxiety or any medication and you're trying to get pregnant, always make sure don't stop your medication. Talk to a doctor, talk to a psychiatrist, make sure your medication is safe for pregnancy and continue it if it is. Because the benefit of the medication definitely outweighs any kind of risk that you're reading up about that medication to pregnancy, because we know that a lot of women have committed suicide pregnant. And so it's a big issue. So we're talking about postpartum, but I just wanted to make sure I mentioned that in pregnancy in itself, we treat depression as well, and we try to keep people on their medication.
That's right.
Or modify it if we have to,
yes.
but not stop it completely or stop counseling completely, because it gets worse.
That's right.
So I wanted to make sure, talked about that.
Yeah, definitely. If you leave it untreated, subsequent episodes will be, in most cases, will be more severe.
Yes.
And more resistant to treatment as time progresses. So catching it early is a rule of thumb.
What's your last word that if you're going to talk to, let's say we're in front of people and this is our opportunity to make people understand how important and how we as a community, whether it be employment, employers or religious organizations or women groups or anything or friends or family, what do you need to tell us that can help us understand that we need to come together and help people to be more aware of mental health?
Yes, I think we need coordination, the government and private sector to come together, civil societies, employers, employees, Nigerians as a whole. We need to realize what we're dealing with, which is a mental health epidemic, pandemic almost. And so the best and the brightest of us should apply their ideas and critical reasoning skills and decision making and such skills to the problem. The problems have solutions that have worked. We can study what's worked in other countries, but we can chart a way for ourselves that are unique to Nigeria. So other countries can look at us and see this is how Nigeria handled their mental health crisis when it came up. But just burying our heads in the sand and not doing anything about it, being in denial and say, oh, it's not happening to me, so it's not affecting me, but it's affecting someone someone you care about. True. So isn't it really affecting you indirectly? So, I think partnership is the word. Collaboration is another word. So I want to thank you immensely for what you're doing.
Thank you.
And for inviting me here today, because I think this is one of the ways that we can get the message out. Education is the third word.
Yes.
And I'll leave it at that. Educate yourself, equip yourself, and be powerful.
Oh, that's powerful. That's amazing. I love it. We could talk about so much already, but being that we have this short time, I think we've done justice to some very important points. So here we go. As we wrap up today's episode of HERcast, I hope our conversation with Dr. Ada Ikeako has shed light on the importance of mental health and how we can all take steps to improve our well-being. Remember, it is okay to ask for help, and seeking support is a sign of strength, not weakness. Whether you're dealing with stress, anxiety, or simply navigating the ups and downs of life, there are resources available to support you. A huge thank you to Dr. Ikeako for sharing her insights and expertise with us today.
Thank you
so much.
Chito. Thank you.
And to our listeners, thank you for tuning in and making the time to invest in your mental health. Let me just pause and say this. If any of you have any issues or concerns, want to meet up with Dr. Ada about anything that you're dealing with, you want to ask questions, please do send us a DM at HERcast Podcast so we can connect you, or at Dr. Chito. Now, HERcast with Dr. Chito is a show dedicated to giving women a voice, empowering them with knowledge and building a supportive network that inspires boldness in pursuing their dreams. HERcast is a movement, and it's a movement that's rooted in the belief that gender equity will transform the world. Watch our full episodes on our YouTube, HERcast with Dr. Chito. Listen on your favorite podcast platform. Follow us on Instagram, like I mentioned, at HERcast Podcast and at Dr. Chito N. And watch on Rapid TV, channel 176, Star Times, every Saturday at 7 p.m. and Sunday at 2 p.m. Until next time, take care of yourselves, mind, body, and spirit. Have a great day.